one of you for taking time out of your afternoon to learn about mini dental implants. Our speaker today is Dr. Mark Broomhead. He's my favorite dentist. So, you're going to learn a lot. We hope you enjoy. There's refreshments, and then afterwards we'll be around to answer any questions that you might have. So, Dr. Mark?
Excuse me. Thank you, everybody. Welcome, welcome, welcome. So you are our second seminar of the day. So we're awake, we're ready to go. We'd like to welcome you to Compton and Dr Dental Center. We're very happy to have you here. We're very happy to have you part of our mini dental implant expo, and just basically give you the benefits that mini dental implants can offer to you, and procedures that you might not really be aware of. So that's why we have you here today. So thank you for being a part of this. First, I just wanted to give you a little bit of background information about myself. My name is Dr. Mark Broomhead. I've been in private practice now for about 13 years. I've been placing conventional dental implants for about 13 years. And I've been placing mini dental implants for about the last 5 years exclusively. I have advanced certification and training when it comes to mini dental implants. Even though I've been a dentist for about 13 years, I still consider myself a newer generation dentist, which is important because I can offer you the latest and greatest in technological advancements when it comes to implant dentistry, which is why we have you here to benefit from those advancements. Another quick little tidbit about myself, I was just recently named one of the top 40 dentists in the nation under the age of 40 by this magazine, Incisal Edge magazine, which is a very, very published dental magazine. And I couldn't do it without the team that we have here today. So, speaking of the team, I wanted to do just a quick introduction to everyone here. First, you already met Nancy, our office manager. She's way in the back there. We have Brenda, who is our marketing director.
Hi, everybody.
Hi.
We have our scheduling and treatment plan coordinators, Joanne.
Hi.
Caitlin.
Hi, Joanne.
And Nicole.
Hello, welcome everyone. Hi.
We have our expanded function dental assistant. We have Ann.
Hi.
We have our resident massage therapist, Gabby, in the back. Gabby, I know you want to say hi, say hello. So that's our team. They're just as knowledgeable about mini dental implants. So as we're going through the seminar here, at the very end, they're going to be available to answer any questions that you may have, in addition to myself being available to answer some questions for you, okay? Okay, so now on to the presentation. You're never too old, or you're never too young for that matter, to see a dentist. So this first video is a video of my daughter Brooklyn when she was 1 year old, preparing for her first trip to a very stressful dental visit with her father. Little grainy, little spotty on the audio there, but that's what do you say to the dentist? And she loves walking around the house saying it. So it's hysterical. It gets me every time. Okay, so chances are, if you're here today, you're missing one tooth, you're missing multiple teeth. You have some broken down teeth, you're unhappy with your smile, maybe you have some periodontal disease, you have a denture that you're sick and tired of taking in and out, it's just not fun to do. Well, relax, you're not alone. Over half of all American adults are missing at least one tooth, and studies show by the year 2020, about 40 million Americans will be in need of an upper or a lower denture. Other studies are showing that after someone is missing 4 or more of their natural teeth, it starts to affect your overall well-being, your self-conscious, your smile, your health. So I'm going to show you how mini dental implants can help improve on those things. And that's why you're here today. Mini dental implants can solve this problem. Mini dental implants are becoming the standard of care when it comes down to tooth replacement, as opposed to traditional implants or bridges or anything that's removable in dentistry, whether that be partial dentures or full dentures. So let's start off by talking about a little bit of the differences between conventional implants and mini dental implants, and the first thing being really just the terminology. A dental implant can range in the size from 2 millimeters to 2.5 millimeters. In that diameter, they're considered a mini dental implant. The next category above 2.5 millimeters is a 3.0 millimeter diameter implant, which really goes either way. It's either a conventional implant or a mini implant. It really comes down to the manufacturer and branding, so it's kind of silly, but it falls in both categories. Anything greater than 3 millimeters in diameter is considered a conventional implant. One of the biggest differences in mini dental implants versus conventional implants is the invasiveness. The word mini just sounds less aggressive. Conventional implants are really considered a surgical procedure. There's cutting that's involved, and you can tell by the hole in the jaw that's done here versus a conventional implant and a mini dental implant. The invasiveness is much less. So that's one of the big benefits in invasive or non-invasive procedures as far as a mini dental implant goes. Because they're so less invasive, mini dental implants, healing time is much less. So when we talk about healing time, we're really talking about the time we put an implant in to the time we build that final restoration on, whether that be a single tooth or a roundhouse of teeth that look and feel like your natural teeth as opposed to a denture. And that could range anywhere from the same day to 3 months. When conventional implants are a little bit longer, and sometimes a lot longer in terms of healing time, going from 3 months all the way to a full year. Now, this is probably the biggest difference between mini dental implants and conventional implants. When my patients come to me, this is their main concern. How much is it going to cost me? Traditional or conventional implants are typically double the cost as compared to mini dental implants. Because we are a mini dental implant center of America, we're one of about 66 in the country. I think there's 3 in the state of Indiana. We can offer this service and this procedure to you at about half the cost as a quote down the street. And somewhere in most regions in Northwest Indiana, or dental offices in Northwest Indiana, the typical quote can be up to $60,000 for a full mouth of dental implants to get rid of those dentures. So we can offer this procedure to you very, very affordable, and we can work with you to make that happen. Okay, so that's the question I get most often, and that's what makes patients most happy about this, as opposed to it being just as much non-invasive as the affordability of mini dental implants. So let's go through just a couple scenarios of how mini dental implants can benefit you. One scenario would be if your current dentures are ill-fitting. Another would be if you're missing all your teeth on the top, if you're missing all your teeth on the bottom, if you're missing a single tooth, or if you're missing multiple teeth. These are all scenarios where mini dental implants can come into play and improve your lifestyle. So again, going on with the benefits of mini dental implants, you can get rid of those denture glues, you can get rid of those adhesives, you can get rid of all those powders, you can eliminate the need for those materials 100%. And if you think about it, you're spending all that money on glues, adhesives, and powders over time. It's going to save you money in the long run. Another benefit of mini dental implants is chewing ability is dramatically increased as opposed to a full denture. And what we mean by that is there's more added support, the foundation is stronger, you're able to get better chewing, which means smaller food particles that you're swallowing, which means better digestion, better nutrients, better health for yourself. Another benefit of mini dental implants is bone loss. So if you're missing a tooth in the jaw, and we'll show you in this next video, or this little schematic we have here, when we have no teeth, we tend to lose bone. And the aging process starts to advance itself a little bit more. By putting mini dental implants into the jaw and functioning better with those implants, we can actually preserve bone structure, we can stop the atrophy of bone, and we can slow down the aging process. We can't stop it forever, but we can slow it down. So that's another important added benefit to mini dental implants. One of my patients' favorite part about getting rid of their dentures or getting rid of their partials and having more teeth and moving on to mini dental implants is the ability to enjoy foods again. We can get rid of the palate part of a denture. We can secure things that are more stable. Things aren't rocking around, they're not moving. So you get the ability, when you have mini dental implants, to eat what you want, not what you can. So that's very important. Another benefit to mini dental implants is those embarrassing moments. Everyone's out and about, they have a full set of denture, or maybe a top or a bottom or something like that. They're loose, they're ill-fitting, they're rocking around, and people are worried or talking like this that they're gonna pop out of their mouths. By securing a denture to a mini dental implant or eliminating the denture altogether by putting a row of implants in there, we can fix this that you have here. You see it there, this row of teeth. We can limit it down to that little material that is permanently fixed into your mouth. So we can avoid those embarrassing moments when the dentures are moving around. We have a funny little video to show you really quick about that as well. So, I don't know how many of you are going skydiving anytime soon, but if you are and you have mini dental implants, securing that in place, that's not going to happen. Okay, so let's just go over a couple before and after photos of what we can do for you here. So, what you see on the right side of the screen is typically what I see in this office for a new patient that's interested in implants. We have broken down teeth, we have missing teeth, there's periodontal disease present, there's a bunch of fillings along the gum line, and this is just not functional, it's not feasible for patients long term. We can take you from the right side of the screen to the left side of the screen literally in one day.
Yeah. So you got the left side is the before.
You're right, my left. Thanks, Bob. I did that in the first seminar. The first run through I did the same thing.
We know what you meant, though.
Thank you for pointing that out. But so exactly, so that side of the screen is what we could do for you permanently, and we can do that in the same day. This is another example of a patient walking in with no teeth present at all. By fixing mini dental implants, top and bottom, I can have you leaving this office with those teeth in the exact same day. A lot of patients ask, and a lot of questions were asked earlier in the first seminar that we had, how long does something like that take? And I know it sounds silly, and I'm not exaggerating here. I can probably get this done in about 30 minutes or less. And that's not with me rushing. It's just because of being such a non-invasive procedure, the mini dental implants can go pretty quickly. And the staff will attest to this, and the team will attest to this. We timed the last one I did, and it was 29 minutes. Now there's other appointments that are involved in everything, but actually getting the implants in, that's about as long as the procedure takes. So that's a huge benefit to mini dental implants. Again, here's another photo on this side of the screen here, where a patient with periodontal disease, even though the teeth don't look as bad in the smile that you might think, they're just structurally not healthy, and the foundation isn't good. So what we did is take all the teeth out and let the patient leave the same day with a row of teeth like that. Similar situation if you're missing one tooth or two teeth in the front. In this picture, we can put mini dental implants in here same day. We can put crowns on them same day. You can leave looking like this. This patient actually has congenitally missing teeth, so the laterals were congenitally missing. In this space, there's no way to get a conventional implant. The space just isn't big enough for a 4, 5, 6 millimeter implant. So the only size implant I can get in there is a 2, a 2.5, or maybe even a 3 millimeter implant. So we don't have this large implant in there, which there's not enough bone for, and then you have the tooth that just doesn't look right. It looks out of place or like a chiclet. So again, this is just an example where we can fix one missing tooth in front with a mini dental implant. We can do it in the front of the mouth, we can do it in the back of the mouth, whether it's a single tooth or multiple teeth, and we can give you back your smile and your teeth just like you had when you're 18 perfectly. So, my absolute favorite thing about mini dental implants is it's a complete game changer. It's a lifestyle change. The team will attest to that. That's why they're here today with me. This is something we love to do in dentistry. It's our favorite thing. We can take those dentures, you can whip them out the window, be done with them forever, not worry about glues, adhesives, anything being loose, sore spots, cuts here and there. We can eliminate that for you forever. And in fact, one of the jokes I tell to patients when they come in with the dentures is, when we joke around and I say, when you leave here today, we're going to celebrate. You're gonna leave out of the parking lot. We're gonna put those dentures under that back wheel, and you're just gonna run them right over. And I say that all the time. And we truly mean that. We can get rid of dentures completely for you forever. Here's an example of what a denture typically looks like. Everybody's familiar with that. And this is what we can limit the size down to with mini dental implants. I can permanently fix this into your mouth and attached by mini dental implants by getting rid of all the palate, all this bulky acrylic, and get rid of those dentures forever. So we can get it down to a row of teeth that you see here that feel and look just like your natural teeth did years ago, and your smile looks that way too. So it's one thing for me to go through slides or a PowerPoint presentation, but it's a whole other thing for you to actually hear it from patients that I've worked on specifically. So we have a couple patient testimonials that we're going to do here for you today. My first patient, her name's Sharon, she couldn't be here today, but she really wanted to do a video to explain to you what she's been through. Again, the video's a little spotty, but I want you to realize this is less than 24 hours after I placed upper and lower mini dental implants for her, and this is what she had to say.
Hi everybody, this is I'm Dr. Mark Broomhead, and this is my location in Fran. We did the procedure, stabilization procedure, less than 24 hours ago. Placed 14 implants, and she's spectacular, she's tough, and she did great with just a tiny bit of aesthetic. I just want to hear a little bit of journey about your experience and how you feel less than 24 hours back.
I would like to tell you that it was a hoot, but it was cool. It was really cool. But there is some hurt a little bit involved. Not that bad. And yeah.
So your pain level today, you feel pretty good. Energy up to 3 to 4 pain medication, but
No pain medication.
so that's really good to hear. I hear that a lot. These just for dangerous in general. So that's really good. You have no swelling, you have no bruising, you have no white. It's not that's the personality just goes there. Is there anything else you can tell us about were you anxious?
Well, it's apprehensive. I think exactly what the apprehensive. But I mean, he's he's really and he's and that was sort of terrific. Didn't go yes, yeah. And that makes a lot.
Yes. So you're happy with your decision, you're happy with your experience?
I am.
Great. And we're happy that you're happy and so take the time to share your experience with everybody.
Thank you.
Thank you.
So the video was a little sketchy there, but one of the more important things I wanted you to hear from that, or as far as the audio goes, was she didn't have to take any pain medication. I wrote her a prescription for pain medication, and I always do because it's a comfort for patients to put in their back pocket just in case. I actually have some bets with some patients. One patient we just did some work on. It's a big cigar smoker, even though I'm trying to talk him out of it. We bet that if he had to take a pain medication, even an Advil, I'd have to give him a cigar. And vice versa if he didn't. Well, I got my cigar, okay? And I don't smoke cigars, so I'll give it away, but that was our bet. So that's pretty common as far as going through pain and pain procedures with this procedure is very limited when it comes to discomfort that we have post-operatively. And for Sharon, even though you couldn't hear that well, that was 24 hours later. She's doing fantastic. The next patient testimonial, I have Ken here. Ken, would you mind coming up here for a second? Ken's been a long-time patient of mine. He's got a lot to share about this procedure. Ken, if you wouldn't mind, just tell us what you got you here. What was your experience like during, and how do you feel today?
Well, first of all, I have to kind of throw him under the bus. He is a hell of a lot better dentist than he is knowing his right from his left. He gets a little confused. I had a bridge across the part of the top that I paid a horrible amount of money for that didn't work. The anchor teeth that they left weren't correct, and so that bridge was broke out more than it was in. And for several months, every week or every other week, I was paying $80 or $85 to get it glued back in. And it would come back out. So once it came back out before I got back home, back to Valparaiso. I stopped doing that after and went and bought a bottle of instant glue and started gluing it in myself. And I went that way quite a long time. One night I was home and sitting there watching television, and that stupid thing came loose again. And at the same time it came loose, there was an ad for implants on television with an 800 number. So I called it, and it was a company in California that does referrals to, obviously, doctors like Dr. Mark. Got the appointment and came up, and it went just absolutely wonderful. It was, they gave me a little happy pill that makes you don't care what they do to you, I guess. I came in here at 7 o'clock in the morning and was back in Valparaiso before 11 with these.
What?
So, and all the uppers were extracted as a full upper, and it went absolutely wonderful. I had zero pain. I told them this morning I have a prescription at home. In fact, I filled it already. You won't even have to go to the drugstore. That I will sell for 50 cents on the dollar. Never been open. It's full bottle, so it works. No pills. No pills. I'm going to say that someday, and one guy in here's going to be a narc.
Yeah.
It absolutely is a wonderful, wonderful experience. The people I work with after I got it in wondered what changed without realizing I had all these implants put in. They thought I shaved a mustache or something. They couldn't figure out what changed, and that is the way it went. Dr. Mark guaranteed me I'll be 75 in a month, and I assured him that I needed these for 11 more years. My goal is to get shot to death by a jealous husband when I'm 85. He guaranteed me I could make it that long. Plus a little. We upped it to 90.
That's right.
He said, we said I'd go to 90. But, I had literally no pain, no bleeding, none of the above. The experience with the staff here and with Dr. Mark has been absolutely wonderful. It's just, there's been absolutely no problems. So, anything else?
Do me a favor, tell them about your sweet corn.
Oh, my goodness. I live out in farm country, and I have not been able to eat sweet corn for years. I could, but I had to cut it off with the juice flying all over the table, cutting it off the top. My neighbor plants, a big farmer, plants 2 acres of sweet corn. And I didn't know that until this year because I finally asked him, how much sweet corn is 2 acres? 40,000 ears. 20,000 ears to the acre. You know, they plant them that far. We picked and ate sweet corn this summer till I thought I was going to die. It's the truth. We ate sweet corn about every day. So I eat steak, I eat sweet corn, I eat apples, I eat anything I want to eat now.
Did
And-
you do that right away? You know,
After the healing process, and he kind of laid out before he wanted me biting those kind of things off, you know,
okay.
so that virtually for me it was right away. I mean, I wasn't doing it the next day,
Yeah.
but there was not issues to prevent me from doing it after he told me you're healed enough to do whatever you want to do. So, and that takes a little bit of time, but everybody's different, so
Yeah.
it worked well.
Thank you. Thank
You're
you,
welcome.
Ken. Thanks for stealing the show from me. Good job. Okay, so really, let's just kind of summarize what we talked about and how the mini dental implants can benefit you. We can permanently replace a single missing tooth. We can replace permanently multiple teeth in a row. We can stabilize upper and lower dentures. We can get rid of glues. We can get rid of and eliminate those embarrassing moments. We can get you back your original teeth that it feels like you had, your natural smile that you had, and you can enjoy the foods that you want to eat, not what you can eat. So today we're offering a special offer, and if you commit to an appointment today, we're offering a free CT scan and a comprehensive exam, which is about a $500 value, and we're going to give you a $200 gift card towards your implant treatment. So thank you very much. Thank you. We appreciate it. Now, the expo is not over. We have some raffles that we're going to do here for you. And myself and the staff, we're going to be available to answer some one-on-one questions that you might have that you might not want to raise your hand for. A lot of them will probably hand